Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hello, Stream Team. Welcome to another episode of Balls Deep. I am your host, Dr. Joe Pazona, and as always, joined by my better half, Miss Kat Williams. How you doing, Kat?
Hi, I'm good. How are you?
Well, what's new? It's been a bit.
I don't know. What's new? I have no idea. Nothing's new.
What are you working on?
Well, I'm working on a foray into real estate.
Oh, how's that going?
It's good. It's going interestingly. This is hard to get going, but a lot of people are moving here and a lot of people are moving from California and New York, and they need me.
Absolutely.
So I'm here for them.
Well, not only do they need you, I think they might need a urologist. So
They definitely need a urologist.
Good for business.
They definitely need a urologist. So what are we going to talk about today?
Well, I thought today we would talk about the prostate.
Okay. No, we're not talking about that because that is not a thing. I think you mean that we're going to talk about the prostate.
Yes, that is correct.
Okay, people, I have to correct this. There is no such thing in medical terminology as a prostrate. If you are prostrate, you are face down on the ground. It's probably not a good thing.
You'd be amazed how many people, have their colorful ways of describing certain medical terminology.
I am certain this is true, but I'm also take this quick moment, and this is probably part of another podcast, but the word realtor, the thing I do in real estate, it is not a realtor, it's a realtor.
Well, now we're just getting a little nitpicky.
Well, now we're just getting nitpicky, but it is. I'm just saying prostate. So we're going to talk about the prostate.
Absolutely.
Which is something I don't have, kind of like self-control.
That is correct.
But it's something men have.
Absolutely.
So I want to talk about what is it? What does it do? Why do we care?
Absolutely.
Hit us first, Dr. P. What is the prostate?
Well, I think before we do that, Kat, I think we're forgetting it's,
I did. I forgot.
It's that time, isn't it?
It's time.
Okay.
Balls deep.
All right, that's better. We have these great sound bites. We have to use them.
I'm
people.
sorry, I totally blew it. My job is on the line. Anyone looking for employment, this job is about to be open at the end of this segment. So,
all right. So you were asking
the prostate.
Yes.
What is it?
All right. So let's get technical, and then we'll kind of talk in more layman's terms. So the prostate is an organ that is part of the male reproductive and urinary tract. So it is located right below the bladder. So if we, I'm not going to stand up and model for you guys. Just a little awkward putting my junk out there. But so if we imagine we have the pubic bone, okay? And right above there is where your bladder sits. And we all know that because when we feel like we have to go to the bathroom, we feel that fullness there. Well, if you go right behind the pubic bone in a man, that's where the prostate sits. So it sits below the bladder. And so when a man has to urinate, the urine passes through the prostate. And so that's its location. And so you may also, if you want to think of it in another way, we know that guys who need, quote, prostate checks get a finger up the butt.
I have heard about this. No one seems excited.
Well, we can get to that later about prostate massage, and there may be some guys.
That's a whole other
there
thing.
may be some guys who disagree with you. But the reason, again, back to our first episode, we're not butt doctors, but we go inside the rectum because if we then press forward, we're going to hit the prostate. So you can kind of imagine you have the rectum, you have the prostate, and then you have the pubic bone all down there. And it can be a little hard anatomically, and certainly something that would be worth Googling up an anatomy video. But the prostate sits in that location. And so then the question is,
what does it do?
What does it do exactly?
Why is it there?
So the reason it's there is that it's part of the reproductive system. So if we think about back to our vasectomy episode, we talked about the swimmers, which are the sperm, which are made in the testicles. Those are then going to travel up the vas deferens, the tube that we cut when we do a vasectomy. So ultimately, though, they got to get into the swimming pool. And the swimming pool is what's called the seminal vesicles. So these are two kind of almost ear-shaped organs, or maybe about this big. Two of them look like little rabbit ears that sit behind the prostate and up the backside of the bladder. And so the sperm come in, mix in with the semen made by the seminal vesicles, but the prostate itself also makes about 15% of a man's semen. It contributes things like fructose and zinc and other things that help to kind of make the sperm have a fertile swimming pool,
Okay.
such that when ejaculation occurs, the sperm are more likely to lead to a conception and a pregnancy.
Okay.
So really, if we had to break it down, the main function of the prostate is for reproduction or fertilization. And without a prostate, you can't get the sperm out of your body in a natural way, but otherwise it is a non-essential organ.
Okay, so if it is part of the reproductive system in men, we kind of understand what it does now, but why do we care so much about it? I hear more things about the prostate, less in terms of the reproductive system. I'm hearing about things like prostate cancer, prostate cancer screening, something called BPH, which I don't think I can define, but I hear you talk about it a lot. And I feel like people want to hear a bit more about that. How does the prostate work or get involved in a cancerous situation?
So there's three main things that can go wrong with the prostate. I'm oversimplifying, but if we had to kind of break it down.
Okay.
So the prostate can get infected. You develop what's called a prostatitis. The prostate can get enlarged, what we call BPH, and lead to urine symptoms. And we've got an upcoming episode where we'll do a deeper dive into that. And then, like many parts in our body, the prostate can develop cancerous cells. And so these are the three main, we'll call them pathologies or quote things that can go wrong with a prostate that you would see a urologist for, depending upon your presenting symptoms and why we care so much about the prostate. So again, the prostate itself is a non-essential organ. We can live just fine without it. The issue is where, the good Lord put it, it's around a lot of important structures. And so that's why we care so much about it, and why when men are talking about prostate disease and such, it's not really the disease they're worried about, it's all the side effects.
Oh.
So if
Okay.
we go back to kind of the anatomy and its placement, so let's first start with the fact that the prostate sits right underneath the bladder. So if we think about a prostate that's getting inflamed or infected, and now urine is passing through the prostate, it's going to burn. When an organ inside our body gets bacteria in it, we can get really sick. So we've seen men end up in the intensive care unit with prostatitis or a prostate infection.
Well, I want to stop you right there and have a quick question. What would lead to an infection of the prostate?
So very often we don't find an underlying cause. This can absolutely happen very randomly.
Okay.
And the term prostatitis gets thrown around a bit, both by physicians as well as lay people, because often if a man goes to a doctor with any, quote, pain down there, and we don't have an obvious diagnosis, we go, it's probably your prostate. That being said, if we're talking about a true infection, we believe that one of the more common causes of an infection are men who have trouble urinating. So if we don't empty our bladder well, and that urine kind of just pooling around and can't get out of the body, then bacteria can build up, and they like to attack the prostate. The prostate, due to its anatomic position, again, is right in front of the rectum. So there's actually some theories that infections happen by bacteria working their way through the wall of the rectum and into the prostate. So sounds crazy and kind of gross, but certainly can happen. And then there's times men get a prostate infection because of something I did as a urologist, the most common one being a prostate biopsy. So very often when we're investigating for prostate cancer, we have to do a needle biopsy, and in some cases we're introducing bacteria into the prostate and it gets infected or inflamed.
What does a urologist do to combat an infection of the prostate, which is obviously different from a cancer or a different kind of symptom? But if if you come into, I don't come into because I don't have one, but
Right.
if a man comes to see a urologist with an infection, how is it treated?
So this is one of those situations, and this is really important for people to hear, where often we are undertreating with antibiotics.
Undertreating.
Undertreating. So there's no doubt that we are way too laissez-faire when it comes to dispensing antibiotics.
Meaning we dispense them too often.
Absolutely. I get a sniffle. I want a Z-Pack. Oh, I don't feel good, or my tummy's trouble. Antibiotic, antibiotic, antibiotic.
Which is not a good thing.
It's not, because our bacteria are actually, we've got good bacteria in our body, and indiscriminate use leads to resistant bacteria. And we could do a whole episode on that. But back to your original question. So number one, we make sure you get appropriate treatment, because a lot of times prostatitis is misdiagnosed and it's mistreated. We then, if we're assuming we're dealing with an actual bacterial infection of the prostate, want to investigate. Why did this happen? Men really should not get prostate infections. And if they do, we want to do a thorough evaluation. Are you emptying your bladder? Do you have symptoms of an enlarged prostate? Is there something anatomically going wrong inside your plumbing system that led to this infection?
Okay. And then on to the second thing you mentioned. So the prostates can be infected and they can also be enlarged.
Mm-hmm.
What happens with an enlarged prostate?
So again, we're going to do a deeper dive into this on our next episode, but for a brief overview, as the prostate swells and gets bigger, it can cause a blockage of the urine flow and cause a bunch of urine symptoms in men. So most often when we jokingly say, dad wakes up a couple times a night to go to the bathroom, or grandpa's at the urinal all day, or, I'm in my 40s and starting to dribble a little bit, that's typically symptoms of an enlarged prostate. And again, it's due to its anatomic position, and that's why it's so important to understand some basic anatomy, and it explains why we have certain things go wrong. And so as that prostate swells, the bladder has a harder time getting the urine out. And this is why when we talk about treating an enlarged prostate, men are worried about side effects, because we have to relieve blockage, but yet what is right near there? We've got the bladder prostate junction or connection, what we call the bladder neck. And then on the other side of the prostate, we have what's called the sphincter muscle. These two things are really important to make sure we don't just have incontinence or end up in diapers. So as we're going to start talking about prostate treatments for both cancer and non-cancerous reasons, we have to keep that in mind. Also, if we go back to, again, the primary function of the prostate is with reproduction. So sometimes these prostate treatments, even the medications, can affect ejaculation. And for some guys, this can be quite bothersome. A lot of us kind of define our manliness by what comes out during our, sexual escapades. And so, this can really bother guys. And so although we joke about it, and I'm sure most women are like, dude, if this is the worst thing going on with you, you're doing just fine.
We don't care.
I jokingly tell guys, listen, sex is going to be a lot cleaner if we end up taking care of your prostate. But in all seriousness, this bothers guys. And so as we think about our treatments, we go back to that anatomy and the fact that it's next to those sphincter or continence mechanisms. The fact that the prostate plays such a vital role in ejaculation and reproduction, we have to be mindful of that as we're going through the treatments.
And like you said, we'll probably cover this last one in a much deeper dive in another, but just as an overview, prostate cancer, which I think people hear a lot about, and it's definitely out there. A lot of men deal with that, struggle with it in different stages. Give us a little overview of prostate cancer.
So prostate cancer is the number one diagnosed cancer in men.
It's the number one diagnosed cancer in men. Okay, I did not know that.
But the majority of men die with it rather than from it. And so what ends up happening is we have developed this mindset that, prostate cancer doesn't kill people, let's not go looking for it. And that's partly true.
But it's not completely true.
30,000 men a year still die of prostate cancer.
Of the prostate cancer.
So it's not zero.
Okay.
So for those 30,000 men and their families,
very important.
Very important. So the key takeaways, again, with a very brief kind of 30,000 foot overview of prostate cancer, is that number one, it rarely causes symptoms. We're talking about a microscopic cancer. So we often get guys coming in going, I got a belly ache or my prostate hurts. I'm worried I have cancer. By the time prostate cancer causes symptoms, it's way too late. So that's first and foremost. So then how do we detect it? Well, we need screening tools. And the two most common screening tools are, number one, that good old finger
That
exam.
finger.
So-
Oh, yeah. Okay.
And then number two, a blood test called PSA, or prostate specific antigen, which is a fancy doctor term for, if we go backwards, a protein made specifically by the prostate. So this is a blood test along with a finger exam that a man should get. Now, a typical follow-up question is, well, when should a man start and how often should he get it?
How often do you need to get that finger?
So,
Sorry.
We're talking about Friday nights here, or are we talking about the doctors?
No,
Okay.
we were simply talking about in a medical office.
I mean, when you lay it up like that,
No,
I
I'm
just gotta
sorry.
smack it over the fence. Good question. I'll give you my take, because you can go online and there's so many guidelines and they all change. And listen, population-based recommendations are nice for, government guidelines. They're nice for studies. Like right now, the American Urologic Association, which is our sort of, governing body, recommends PSA screening from age 55 to 69.
Not before or after.
Now, for any of you who just heard that, you go, probably like me, that's ridiculous, right? Like, so at 54, you shouldn't look for it, but the day hits 55, or a 70-year-old shouldn't get a PSA. Where did all this come from? Well, it comes from, those guys living in their crystal palaces of academia, all getting together and spending lots of money and running these research. And guess what? When they ran some study and looked at the cohort, fancy doctor term for the portion of patients in which PSA had a benefit, it was only in that age group. But again, that's just ridiculous. I mean, who's going to remember age 55 to 69? And all you need is to have one guy who's 50 get an awful prostate cancer. And you go, well, why didn't I start in my 40s? So here's my take. I think every man should have a baseline PSA in their 40s. We're not at a time of...
Is that 40 or is that 45, 47?
There's no hard and fast rule. I had one when I was 40. I think if you've got a family history, absolutely by age 40. And I would also recommend if you're African American, there's definitely a genetic component to prostate cancer, and it tends to affect different ethnicities at different rates. So again, family history, African American, absolutely by 40. Everyone else, sometime in your 40s when you're going in for some blood work. I don't think it's ever too soon. Probably in your 30s is not necessary. And, then depending upon what your level is, get it checked every couple years. Starting at age 50, I'd absolutely have it added on to your annual blood work. Listen, we're not at a stage in U.S. healthcare where we're rationing care, or we're at socialized medicine. So this mindset that I often hear from non-urologists is, oh, you're bloating the cost of healthcare. This is like a couple dollar blood test. Like, of all the things that you want to go after, is a disease that kills 30,000 men a year, and checking a blood test really the one. We tend to make these leaps in medicine, like, well, if I get my blood test checked, next thing you know, I'm going to be laid up at home in diapers because my prostate got removed for a cancer that wasn't going to hurt me. And that's ridiculous.
That seems far-fetched.
You're taking there's a lot of steps along the way before you get there. So I think, again, for the purpose of this episode, get your PSA checked sometime in your 40s. If it's at all elevated, go see a urologist. If you have a family history, if you're African American, even if it's slightly elevated, go to a urologist, someone who specializes in treating prostate cancer, because often even waiting till it's, quote, abnormal can sometimes be too late. So.
Okay, great advice. Great advice. Well, I think I got much more information today on the prostate, again, not the prostrate, that I had before. And so let's break it all down for a final little recap that I like to call Just the Tip. Number one, the prostate is part of the male urinary and reproductive systems. Number two, you can live without it, but it is near some pretty important stuff. Number three, prostates can be infected, enlarged, or cancerous. and your urologist can help.
Absolutely.
Did I get it?
I think you did. I think that was a great recap, Kat.
Well, thanks. You're welcome.
Yeah.
You're welcome.
Did you learn something?
I did. Mostly, I want everyone to walk away with the understanding that it is not your prostrate. And also that the word is realtor. Realtor.
Well, I don't think we can close this episode without just a quick little blurb on prostate massage, because, I mean, we alluded to it earlier.
This has jumped the shark, but okay.
So
if you feel you must.
By no means am I an expert in this particular practice. Not something we get in our residency training.
I feel as though I should leave the room at this point.
But that being said, I think, listen, for what did they say? Don't yuck someone else's yum is a statement I've heard before for people who have different fetishes and other
really
things.
riding the line here.
But no, I mean, listen, the prostate, there's nerves going back there. And one thing we didn't allude to in the anatomy is that the nerves to erections go right alongside the prostate. And so it makes sense that any sort of safe prostate stimulation could potentially be erogenous for some guys. My tips from your local urologist: please use lots of lube, and please don't insert anything that can ultimately get stuck, because there certainly have been plenty of on-call phone calls to the colorectal surgeon.
Oh, good.
Thank God I don't deal with this as a urologist. I deal with foreign objects elsewhere that have to go and get retrieved. So with that being said, your public service announcement, if you're going to do a little prostate play, just please be safe. So.
And on that note, ladies and gentlemen.
Absolutely. Well, listen, always a pleasure. We would absolutely love it if our stream team, which is all of you, subscribed on YouTube or subscribed on your favorite podcast venue, whether it be Apple Podcasts or Spotify. We're really having a lot of fun. We hope you find that this is valuable information. And if not, that we at least gave you a little smile. And, who can't smile talking about a little butt play, right? So.
Wow.
So until next time, remember to show yourself a little more love and grace. We are all works in progress, and these are opportunities to improve. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.